Hi everybody, Dr. Ben Shamoiel, the LA Chiropractor right here in Century City, Los Angeles, California. Let's talk about spinal decompression and if it's for you. Might be, might not be. Let's get to figuring that out. Now, let's first talk about the problems that we usually see where spinal decompression is very, very useful. The top one is sciatica. If you have not seen my sciatica video, I'll put a link up to that either down into the link area or a little clip right here, so you can go and check out my sciatica videos and see if you really have back pain, sciatica, or radiculopathy. What is it that you clearly have? But let's say you do have sciatica, which is comprised of several nerves that are in the lumbar spine. Usually, most likely, it's due to loss of space, thinning of the disc area. So this is the anatomy class for you. These are the discs, these are the vertebrae, and these are the nerves that come out your spine. You can see that there's the lumbar spine, beautiful sacral pelvis, and here your hip bones right in there, and then all the way up to the skull right there. So quick anatomy class. Now usually when we're dealing with areas of compression, where we are putting a lot of pressure onto the discs, could have been from sports, could be from sitting all day, could be from the other day we had a patient that had a lap belt on in a car accident years ago before her parents had shoulder belts. So when she had an accident, guess what? That lap belt was here when she was young and now put a lot of stress onto that low back. So all of these things could be causes. That's why people get sciatic pain. It could come from multiple different things. Now, when we have compression here, a couple of things happen. Imagine an ice cream sandwich. That's pretty much what it looks like. It's when you squeeze it and it's softer, all the ice cream starts to come out. And these are kind of like, I would, either compare them like ice cream sandwiches or jelly donuts. And then when the jelly starts to pop out like a herniated or bulging disc, kind of like that there, it hits a nerve and we have a big problem. Now, most of the time it's not surgical, so it's very unfortunate where people go and get surgery for something that is non-surgical. So in our office, when we're using our decompression unit here and we strap in the patient, what we want to do is we want to open up some space. Now, a couple things you need to know about the disc, more anatomy and physiology, that the disc does not have a clear blood supply in the center, so it doesn't really hydrate well. It's cartilage. It does have a lot of blood flow on the outside, so by pumping, by stretching and releasing and stretching and releasing, we're absorbing moisture back into the disc and hopefully creating some space. So it opens some of the areas on the nerve roots that are really causing the shooting pain to go down your legs. So as we strap the patient in and we start to decompress that area, we're looking to open up space. You see where those yellow nerves are coming out, those yellow plastic nerves are coming out? That's called the foramen. That's where the nerves come out. So you might have gotten a diagnosis of stenosis in your spine. Well, stenosis just means narrowing. It sounds scary, but it's just narrowing up that space due to the fact that you've pretty much lost disc space. Now, do they grow back? They don't always grow back. It's not like it's something that grows back, but can you rehydrate some of them and just try to get some space and open up some freedom? Absolutely. So we've noticed that most of our patients, and then there's some that have some really bad disc protrusion and they're at that point, really, it's too late. This is where surgery does come in handy. But I can tell you from our stats and some other stats that 70 to 80% of the back surgeries for this kind of treatment is really, I wouldn't say unnecessary, but could be avoided through spinal decompression. So for about 30 minutes, our machine here gradually opens up and lets go, opens up and let's go. Again, patient strapped in from the top, strapped in from the bottom. As you can see here, these are the shoulder straps. We have pelvic straps. This kind of hooks onto the pelvic straps, and then it pulls down. Legs go here, head goes up there. And when we're dealing with our patients, we're opening this area up and creating some freedom and really getting some pain relief. Now, if you have multiple discs, it could take longer. If you have severe degeneration, it could definitely take longer. But does it work? Yes, it does a great job, helps a lot. Now, we have things like sciatica, radiculopathy. That means numbness. It's a different part of the same nerve, right? Pins and needles, different part of the same nerve. So this is one of our greatest approaches to relieve and open up the nerve flow. Now, here's the neck area, and we also have, our machine works for cervical radiculopathy. That means the same kind of problem, shooting pain down into the arm, right? Shooting pain or numbness going down into the arm on one side, and that has to do with compression of the neck. So we want to open up that space and make sure that those nerves are open and get some relief. You can check out some of the testimonials that we have and some segments that I'll put somewhere on here. So you can go to the testimonials for our spinal decompression. So that's how spinal decompression works. It opens up some space. It tries to pull in the discs by creating a vacuum. It pulls in hydration back into the disc slowly. It does help. It does help to get healthier discs so you don't lose them. So when we're dealing with sciatica, when we're dealing with radiculopathy, when we're dealing with a lot of this low back issues, and you've tried chiropractic, you've tried acupuncture, Pilates, yoga, and you've tried everything, you know, been a chiropractor for 20 years. This is just the next level of the procedure. We can help the rotation. We can help the angles. One thing that was very challenging is the decompression part, and that's where this machine comes in to really open up that space. So if you have any questions or concerns and want to see if spinal decompression is for you and you're looking to avoid surgery at all costs, again, very effective way, low risk, ultra low risk. Everything is measured, it's calculated, it's all digital, so it feels exactly how much pressure is being applied. So very hard to injure something like that. Unlike surgery, where the surgery might not correct the problem, the surgery might fix one thing and create another problem. And the last one is rehab, medication, and you're out of it for a long while before you can get back onto it. Some of the surgeries, if you don't know, or happen on the disc, they actually have to go through the abdominal cavity. So they have to go through intestines and everything to get to this part of the discs. Disc replacement are still really early in the game. Still tricky. Again, fusion is tricky. Again, putting in a titanium plates in here and creating a titanium strength here is just going to push the stress over to the ones that don't have titanium. So you can get surgery and notice that within 8 to 10 years, now you got back pain again because you really didn't fix it. You really put strong titanium support, and the rest of the spine now has to take the stress, right? So we want to make sure that it helps. So I hope that helped. And if you got any questions, let me know. Again, it's your spine right there. You only got one. Take care of it. Don't forget, Dr. Ben's got your back.